And welcome back. Now, South Africa's COVID-19 infection numbers are now heading towards 1.5 million mark. And the tragic death of each and every coronavirus patient was highlighted in the past week by the loss not only of Minister Jackson Mthembu and jazz icon Jonas Gwangwa, but of the devastating end of a medical team at the forefront of fighting this pandemic in a helicopter crash. And add this, of course, to the thousands of South Africa who are also losing family members on a daily basis. We get to the part where we now start talking about a vaccine. And there is, of course, also talk of a third wave at the end of our summer. And this makes it even more grim. And welcome now to Minister of Health, Dr. Zweli Mkhize, to give us an update and also to talk to us about what can be expected. Before we get into that, let me welcome Minister first. Minister Mkhize, always good to have you. Welcome to Morning Live.
Good morning, Sakina and all the viewers.
Minister, before we actually get into the conversation, we're running a poll this morning with regard to the vaccines, and if we can just put it up. What we're asking this morning of our viewers is this. We're asking them to participate in a poll that asks, should politicians receive the vaccine first, last, according to the prioritization, according to careers? As we heard, frontline workers will be first in line to receive the vaccine, and don't care. Well, I'll have you know, at the moment, 48.4% of the respondents are saying that politicians should be first. 19.8% say they should be last. 8.6% says against the prioritization that has been effected. And 23.2%, the second highest number of people, say we actually don't care. So just thought I'd put that out to you, Minister. We're going to run that poll just to get a sense of how South Africans feel about that particular issue. But getting back to other matters and vaccines in particular. Now, information seems to differ as to when exactly we will be receiving the first batch of vaccines. And just reading through a few international wires, it would seem as though the South African dosage is on its way. But when can we expect it?
Well, we expect it before the last day of the month. So they will give us exact confirmation when it's loaded. We will announce when it's loaded. Right now, we can just say if we're still on course to have it by the end of January.
End of January, Friday, some have said. Is that a good date?
Well, let me say around that time, but we're quite certain we will get it by the end of the month.
So how much exactly are we getting? And of course, it has put us back a little bit, hasn't it, in terms of previous discussions that we have in terms of the arrival of the vaccine, Minister?
Well, we did say it will be arriving in January. The real challenge is that the day-to-day changes have to do with delays in this signature, delays in that, but we are assured of the date that we've actually agreed upon. We're still on course because the issue was to target January, and we haven't got any reason to worry about that change. So until we get to the end of January, we mustn't think that there's anything that's gone wrong. But secondly, we did say that as soon as the vaccines come, we will then start, the vaccination program in February. Our plans are on course. Again, that we will be able to take our health workers through on that program. We're anticipating 1 million vials, and then next month we'll be expecting another 500,000. And so we were saying that the rest of the dosages will be announced as the agreements are confirmed. They are quite advanced at this point, and so we'll be announcing them anytime.
So, Minister, how much of the vaccine are we expecting at the end of January?
We're expecting 1 million doses.
And this is from AstraZeneca?
That is from the AstraZeneca vaccine produced by Serum Institute in India.
So of this million, all of this will be going to healthcare workers as per your previous discussion with us. Am I correct?
It is correct. The first target is going to the healthcare workers, and there will be additional doses that are coming in. We just don't want to clutter the discussions until we've got exact dates, because there's quite a lot that is being still expected in February and March.
Okay, in terms of quite a bit, how much exactly are we expecting, especially for February?
Well, February, the first 500,000 will be coming from Serum Institute, but there are others that we will announce which will be coming in February. But the first amount that we had committed, the 1.5 million, is definitely on course, and there are additional amounts, but the additional amounts have to be confirmed once we've got the exact date. Then we will indicate what date they're coming.
So now that we know that the vaccine is literally on the runway to South Africa, one of the issues that we have had difficulty in talking about was the price of these vaccines. Are you now in a position to tell us exactly how much we paid per dose?
Yes, we can divulge the price. The Serum Institute charges $5.35 per dose. That is dollars. So that is the amount. Then the others that were negotiating, for example, the J&J negotiations, the price is around the $10 mark. The Pfizer is around the $10 mark. The issue with Pfizer was that it was much higher before. It was about $15, but we're still negotiating those prices. But I'm just giving you a sense of the ballpark numbers that we are working on.
So with regard to the AstraZeneca that's coming from the Serum Institute of India, at the end, what is the end price of it all? Because you say around $5 for the vaccine itself. What about transport and storage costs? How much does it cost as net cost in the end?
I don't have that amount. We will deal with that, but I think the bigger cost actually in this particular batch is not going to come from the cost of transportation. It's going to come from the cost of administration. The cost of administration, the additional ancillary, payments that are going to have to come in. For example, the use of swabs, the needles, the syringes, the persons who are going to be doing all of that. So that's going to be an additional price that we're going to have to bring into it. Yeah, at the moment, we are estimating that just the cost of the syringe and swabs and so on, administering, could come to close to about maybe 60 rand. So that figure depends on whether you're getting a private, someone to administer it, or you want to administer it within the government department. Therefore, it will vary there. But there is an additional cost. The cost largely is on there. Then the cost of transport and logistics is still being finalized, because the requirements are not quite the same. If you got the AstraZeneca, the requirements are not as onerous as if you were to get the Pfizer vaccine. So that is still being worked on, depending on when each one is going to be arriving.
As per the Pfizer vaccine, and looking at the storage conditions for that at minus 70 degrees, how much of that are we realistically able to procure and actually store?
Well, we had a very long discussion with Pfizer. Their packaging also does take into account the temperature requirement. So it makes it fairly easier. And secondly, what they've offered to do is that we must designate they said we must designate the areas where we can store all of this. So they will then deliver about maybe up to 10 major distribution centers in the country. And those would then be where we'll focus on the temperature, the rigid temperature requirements. Then the others, depending on how far out of the main center we're distributing, we will then, have that requirement also fulfilled. But there's a lot of interest in the private sector to offer this. There are also laboratories in the government service, particularly agriculture, who have actually got those kinds of requirements. So it depends as well on how frequently and what amounts are we taking. All of that together means that we will be able to manage it. But at the moment, we're not worried about the fact that we may not be able to manage the lowest degrees that are possible. We think that is well within our capacity to do so.
And then it raises another question, because last week there was a presentation about the efficacy of the various vaccines. Pfizer was said to be about 90% efficacious, whereas your AstraZeneca about 70%, etc. They actually ran through the various vaccines. So could that possibly become an issue of who gets which vaccine in particular?
Actually, it does not yet matter too much who gets which vaccine. The approach is, let's get whatever vaccine we get and administer to make sure that our people are safe. Now, there are two issues about the efficacy issue. The first one is that efficacy means what are the chances of your body developing immunity. So the efficacy means that if you've got 70% chance of developing immunity, it's good enough for a start. And then the only issue where it's affected, it affects the total number of people who must be vaccinated to get population immunity. So the lower the number, the lower the efficacy, the higher the number of people who must be vaccinated. So in this case, depending on whether we're using largely the 90% efficacy or the 70% efficacy, it might then vary the 40 million that we spoke about. If it's all 70%, we might have to up the number so that we vaccinate more people than to get population immunity. But the safety of the individual is generally assured if you've got the efficacy, over 60%, 70%. But the real issue for us is that each one of these vaccines have been approved. And so because they're approved, they are actually good to use. Then we must just always recalculate what the numbers are of the people who must be vaccinated so that we can get population immunity widely.
And still on that question, if we talk about vaccine equity, again, what are the chances of those well-heeled members of our society who can actually afford it, who may have the financial muscle, to come out and say, well, I actually want that vaccine that is 90% efficacious, and for them to actually jump the queue, as we saw reported about Johann Rupert, who went to Switzerland and managed to get the vaccine ahead of Swiss nationals even, because he was able to hop on his private jet and go there?
Well, let me put it this way. Firstly, we will have enough vaccines to deal with the health workers, and then we'll have vaccines that will then take into account all the frontline workers and people who are in vulnerable settings, and then people with comorbidities. Now, that huge batch means a lot of people would need to have access almost at the same time. That's the second phase. And then, of course, the third phase will be those who are well and that who didn't have any problem. Now, in this case, the bulk of the people are going to be coming in during the second phase. By then, we believe that we'll have enough vaccines to be able to carry the numbers that will require the vaccine. So we don't see that it's going to be a big issue, because the numbers who will require vaccine are going to be large anyway. So the choice of vaccines, at the moment, to us, it will not matter too much. But what will happen is that we will be getting the cross-subsidization from private sector. In other words, when we ask for medical aids to make the vaccines available to their members or to their patients, they will then pay enough to ensure that the other South Africans who don't have medical aids also can get the same vaccine. So it will be shared in that way. It's a cross-subsidization or social solidarity approach. We've got a technical way of how we're going to deal with it as a kind of markup inside the payment process between the government and the medical aid. But we will have this variety, and therefore we will actually be expecting some of the private sector medical aid to put in money for paying for those vaccines, but they will not only be available to those who have been paid for by the medical aid, they'll also be available to the general public. So that is not a big problem for us.
Minister, we're up to news time, so we're going to get headlines from Leanne and then we'll continue this conversation. Minister of Health Dr. Zweli Mkhize in conversation with us about issues around vaccines and, of course, rollout plans. And as he said, we are expecting the first batch of vaccines to hit these shores before the end of the month. That means before Sunday. So let's find out from Leanne what's making headlines in the news.